Every year, hundreds of millions of people are infected by a tiny traveler that carries a massive medical burden. Dengue fever, often called breakbone fever due to the excruciating joint and muscle pain it causes, is no longer just a tropical concern. It is a global health priority. In this comprehensive guide, we will simplify the complex pathology of the dengue virus, from the moment a mosquito pierces the skin to the critical recovery phase. Whether you are a student, a traveler, or someone living in an endemic area, understanding the mechanics of this virus can literally save a life. Let's start with the culprit, the Aedes aegypti mosquito.
The Aedes aegypti is a sophisticated biological machine. Unlike many mosquitoes that hunt at night, this species is a daytime biter, peaking in activity shortly after sunrise and several hours before sunset. It thrives in urban environments, laying its eggs in clean, stagnant water. Think flower pots, discarded tires, or even a pet's water bowl. When an infected mosquito bites a human, it injects the virus through its saliva into the bloodstream. Interestingly, the mosquito itself remains infected for the rest of its life, acting as a permanent reservoir for the virus. Understanding this behavior is the first step in effective prevention.
Dengue isn't just one virus. It's a family of 4 distinct but closely related serotypes. You can think of them as cousins. Being infected with DENV-1 gives you lifelong immunity to that specific strain, but only short-term cross-immunity to the others. This is where it gets dangerous. A secondary infection with a different serotype, for example catching DENV-2 after you've already had DENV-1, significantly increases the risk of severe dengue. This phenomenon is known as antibody-dependent enhancement, or ADE, where the body's previous immune response actually helps the new virus enter cells more easily. This is why a second bout of dengue is often far worse than the first. Dengue is common in tropical and subtropical regions, including parts of Africa, Asia, Central and South America, the Caribbean, and the Pacific Islands. The clinical course of dengue is divided into 3 phases. First is the febrile phase. This usually starts suddenly with a high-grade fever, often reaching 40 degrees Celsius or 104 degrees Fahrenheit. Patients typically experience a severe retroorbital headache, pain right behind the eyes. This is accompanied by generalized muscle and joint pain, which is why it's called breakbone fever. You might also notice a transient flush or a maculopapular rash on the skin. During this phase, the virus is circulating heavily in the blood, a state called viremia. Dehydration is the biggest risk here, as the high fever and potential vomiting lead to rapid fluid loss. As the fever breaks, usually around day 3 to 7, most people think they are getting better. But for some, this marks the beginning of the critical phase. This is the most dangerous window, lasting 24 to 48 hours. The hallmark of this phase is an increase in capillary permeability. In simple terms, your blood vessels become leaky, allowing the liquid part of the blood, plasma, to escape into the surrounding tissues. This can lead to fluid accumulation in the chest or abdomen, and, most dangerously, a sudden drop in blood pressure leading to shock. Monitoring the hematocrit levels in the blood is vital here, as a rising level indicates the blood is becoming too concentrated due to fluid loss.
It is crucial to recognize the warning signs that occur just before or during the critical phase. If you or a loved one experiences persistent vomiting, severe abdominal pain, bleeding from the gums or nose, blood in vomit or stool, difficulty breathing, or extreme lethargy and restlessness, you must seek emergency medical care immediately. These signs indicate that the body is struggling to maintain its fluid balance. In severe cases, dengue hemorrhagic fever can progress to dengue shock syndrome, which is life-threatening. Early intravenous fluid replacement by medical professionals is the only way to stabilize a patient in this state.
Doctors diagnose dengue using medical history, travel history, physical examination, laboratory blood tests. Blood tests may include NS1 antigen test, which detects early infection, PCR testing to identify viral genetic material, IgM and IgG antibody tests, complete blood count, or CBC. Doctors also monitor platelet levels because dengue often causes platelets to decrease. Another important measurement is hematocrit. An increasing hematocrit may suggest plasma leakage, which is a warning sign of severe dengue. Healthcare providers also assess whether the patient meets clinical criteria for dengue based on symptoms, laboratory findings, and warning signs. There is no specific antiviral cure for dengue. Treatment is entirely supportive. The gold standard is aggressive oral rehydration, water, juice, and oral rehydration salts. For fever and pain, only use paracetamol, acetaminophen. This is a critical safety point. Never use aspirin, ibuprofen, or naproxen if dengue is suspected. These drugs are blood thinners and can exacerbate the bleeding tendencies and platelet issues associated with the virus. Rest is mandatory. Most patients recover fully within 2 weeks, provided they stay hydrated and their vital signs remain stable during the critical phase. Prevention is our strongest tool. Since the Aedes mosquito is an urban dweller, source reduction is key. Every week, empty out any containers that hold water. Use insect repellents containing DEET or picaridin, and wear long sleeves when possible. If you are in a high-risk area, ensure your windows have screens, and use mosquito nets if your home isn't air-conditioned. While vaccines are becoming available in some countries, they are often recommended only for those who have had dengue before. Protecting yourself from the bite is still the most effective strategy for everyone. The outlook for dengue fever is generally excellent. Most people recover completely within 1 to 2 weeks without lasting health problems. Life expectancy after recovery is usually normal. However, severe dengue can become life-threatening if treatment is delayed. This is why recognizing warning signs early is so important. Dengue fever is a complex challenge, but with the right knowledge, we can manage it and prevent its spread. If you found this explanation helpful, please share it with someone traveling to a tropical area or living in an endemic region. Knowledge is the best medicine. Don't forget to subscribe to MedSimpleTv for more deep dives into the medical topics that matter most to you. Stay healthy and stay informed. Subscribe to MedSimpleTv for more simple and clear health education videos every week.